Hello, I'm Karen Parry, Manager of Information Services at the East Brunswick Library. I'm joined here today by Dr. James Salwitz. Welcome, Dr. Salwitz. And he's here today to talk about a program that will happen at the library on Thursday, May 19th at 12 o'clock in the afternoon called Frankly Speaking About Cancer, Clinical Trials. Welcome, Dr. Salwitz.
Karen, thank you very much for having me.
Thank you so much for coming. And can you tell me a little bit about why would clinical trials be important to somebody?
Well, 2 weeks ago, the American Society of Clinical Oncology announced the treatment of the year, which is a new phenomenon for us, having a treatment, found to be the best in the year. And the treatment of the year was immunotherapy. And the reason that they chose immunotherapy to treatment of the year is because of all the breakthroughs in new immune therapies that have just happened and treat diseases we're now treating using the immune system that we could never treat before. But when you think about this happening now, it's remarkable. People have been talking about using the immune system to fight cancer for 30 or 40 years. But we never understood really what the immune system was, and we certainly didn't understand the relationship of the immune system to cancer. So that journey of 30, 40 years has been about research. And it's been about bench research, and it's been about clinical trials, and it's about individual patients and doctors and whole clinics working to develop these immune therapies. So this made us kind of step back and say, research, clinical trials are important not just to the future, but they're important to individual patients, and they're important to what is happening right here in our community. So we wanted to spend some time talking to patients about what clinical trials mean, what research means, but most importantly, what it means for them as an individual, how they can get involved, should they get involved, how would they choose an immunotherapy. So we're excited to have a morning as the Regional Cancer Care Associates in cooperation with the cancer support community in order to talk about this really remarkable and exciting topic. We've had more therapies approved for cancer treatment this year than the year before and the year before that, and a lot of them are based, on brand new and exciting research, and there's a tremendous opportunity for patients to learn about this.
That's wonderful, Dr. Salwitz. Can you give us an example of how clinical trials have been used in a real-life setting?
Well, let me talk about a patient I saw yesterday. So it's a middle-aged woman who came to me, unfortunately, with lung cancer. And we talked at length with her and her family, and we fortunately identified for her a very new, exciting genetic-based therapy, which was only recently approved, what people would call precision medicine, and that is the use of an anti-genetic target to shut down a cancer. And we said to her, there's this very exciting therapy that's available, only approved in the last 2 years. They came out of research, and we said, so this is a possibility for you, and you should really think about it. But there's also a research study going on, in this case through our practice, which takes this basic treatment, this genetic therapy, and adds another treatment to it. And that's an experimental idea. There's very good reasons to believe that the new treatment may be better. It's certainly not going to be worse, but it's not proven yet. Therefore, I can't give that patient that double therapy outside of an experimental trial, but inside a research trial, there's a tremendous opportunity. And when you talk about experimental trials, you're not talking about saying you're going to give one person a treatment and one person a sugar pill. That's not how cancer research is done. You start with the best therapy in one hand, and then you try to improve and add to it. So for this patient yesterday that I was talking to, I was saying, this is an opportunity for you to be involved, if you wish, right here, in order to to give yourself perhaps a better opportunity of successful treatment, and also improve what we understand about cancer, cancer itself.
That sounds wonderful, Dr. Salwitz. What a wonderful program for the community, so informative. And I encourage all of our residents to please come by. And please tell us again, this is being co-sponsored by?
So it's Regional Cancer Care Associates, Central New Jersey, and the Cancer Support Community of Central New Jersey. And the Cancer Support Community, by the way, will have a community social worker there at the event to answer questions in general about support services for cancer patients in our community.
Thank you again, Dr. Salwitz, for joining us today.
Absolute honor.